Good afternoon, everybody, and welcome. I'm glad that you're all here. Welcome to the Janice Pogue Lecture in 2025. Most of you know who I am and who we are, but for those who don't, my name is Herzl Gerstein. I'm the current Executive Director of the Population Health Research Institute, and have been here since its founding in 1999, and have had the real pleasure and privilege and joy of knowing Janice Pogue very well. Janice, for those of you who don't know Janice or never had the pleasure of meeting her, Janice was a biostatistician, and I think her first job was here before we even were PHRI. She was biostatistician in 1995 or 96, I believe, working with Salim and myself, and Jackie Bosch, and Eva Lon. And I think those were the main people here at the time. And then eventually when PHRI started, Janice was our first head of biostatistics. She subsequently did her PhD while she was working here. She started off with a master's degree, and really laid the foundation. Today we had a wonderful afternoon of biostatistical discourse and interaction, and I think it was all fun. As I said a minute ago, it was like a nerd festival, but we all enjoyed it and we all had fun with it, which is great. And we actually, all of us here do enjoy that. Janice laid the foundation for biostat, and for all of you here today. That is, she set the tone, and she set the attitude. And Theo came, where's Theo? Shortly after we started, and Theo came in 1997 or 8. 99, and so I know Theo knew Janice very well, and PJ did, and others, and really set the tone, not just in doing the statistics, but in being innovative, coming up with novel solutions to statistical problems, and was highly regarded both by everybody here, as well as people at the FDA and the NIH and around North America and the world, in the statistical world and in the clinical trials world. So we miss her dearly. She tragically died in 2016 after a serious illness, and it still saddens all of us, certainly me and others who know her, to think about that. It really was quite tragic and quite sudden. After that, we created, in her memory, the Janice Pogue Lecture. And if you look at the list of lecturers, we've had the best of the best of the best to come and speak to us, and in her honor. So that's all I'm going to say. So I want to welcome this year's speaker, and Shrikant is going to introduce Diane. And I want to welcome all of you to PHRI and to this lecture. Afterwards, there will be a reception as well in Lahana. We'll talk about that. So I'll call Shrikant up now to introduce Diane. Shrikant.
So it is my great pleasure to introduce our speaker today, Dr. Diane Catellier. She's a Canadian biostatistician with more than 25 years of experience in collaborative research and coordination of large-scale public health studies. I had the pleasure of meeting her and working with her at the Collaborative Studies Coordinating Center of the University of North Carolina at Chapel Hill, where she is now an adjunct professor. She currently is a senior biostatistician at the Research Triangle Institute in North Carolina. She has been principal investigator for data coordinating centers affiliated for 5 multi-site clinical trials and 4 prospective cohort studies funded by the National Institutes of Health in the United States, contributing to the design, implementation, and that includes data management and monitoring, analysis, and publication of multiple studies. Currently, what she tells us occupies most of her time, is she's the principal investigator of the Data Coordinating Center for the Environmental Influences on Child Health Outcomes Cohort Study. It's called the ECHO study. And she's the PI of the Data Analysis and Coordination Center. The ECHO cohort study is an extensive resource for elucidating the roles of environmental and genetic characteristics that affect child health. She has been involved in exploring risk factors for heart disease, heart failure, stroke, and cognitive impairment, and the impact of acculturation on the health among US Hispanics in 2 NHLBI-sponsored cohort studies, one of which that I worked also with her. She has also helped design and implement an evaluation of Centers for Disease Control and Prevention supported community-based public health prevention and control programs using data from existing surveillance systems and primary data collection efforts. She's talking to us today on enriching the research infrastructure and data science to facilitate broader sharing of data and resources with the scientific community. So welcome, Diane.
I was supposed to give a thumbs up that I'm ready. Is that okay? Good. Well, it's a tremendous honor to deliver this year's Janice Pogue Lecture here at the Population Health Research Institute. Janice was known not only for her extraordinary expertise in biostatistics and clinical trials, but also for her deep commitment to collaboration and to making data truly work for science and society. She understood that carefully curated data, when shared and interpreted with rigor, can generate insights far beyond a single study. So her legacy reminds us that data are more than numbers. They're a resource for discovery, a foundation for trust, and a bridge between disciplines and communities. In that spirit, my talk today about enriching the research infrastructure and data science to facilitate data sharing builds on Janice's values that she championed. I'll explore how we strengthen the systems that make data findable, accessible, interoperable, and what's the last one? Reusable, so that the next generation of population health research can not only answer today's questions, but anticipate tomorrow's. This lecture is both a tribute to Janice's vision and a call to carry it forward, to create a research ecosystem where sharing is the norm and where data truly serve the global good. Let's see, what do we have here? Oh, sorry, this was meant to be up there when I was saying all that. Back in 1989, Dr. Terry Montague, which maybe some of you have met before or know, had the vision to invest both infrastructure and people to build a lasting capacity for initiating, coordinating, and conducting cardiovascular clinical trials in Western Canada. At that time, Dr. Teo was finishing 2 years of training at the National Institutes of Health in epidemiology and clinical trials, making him where is Teo? Oh, there he is. The ideal person to assemble a core team and infrastructure needed to conduct high impact trials. Recognizing the need for expertise in data management and statistics, he brought me on, a young mathematician, to design systems for capturing data and to create monitoring reports. So this laid the early investment and the foundation for rigorous trial infrastructure that followed at the University of Alberta. Okay, from the initial conceptualization of the SCAT trial, that was the first clinical trial at the University of Alberta, to reaching the conclusion that lipid-lowering therapy with simvastatin slowed the progression of coronary artery disease, it took 10 years. Rigor takes time, but shared data turns years of work into lasting infrastructure for science. So let's get into the meat of this. Why share data? So in recent years, funders of research around the world have issued a call for broad and open data sharing to extend scientific findings and encourage new science. So data are expected to be made as widely and freely available as possible, while of course safeguarding the privacy of participants and protecting confidentiality of data. So the Canadian Action Plan on Open Government commits to the open science, emphasizing open science to research and improved data management. And I've met so many people in data management today. You all understand your role in this. So it's not just funders, it's the journals are also raising the bar. Increasingly, they won't publish a data unless a data availability statement has been provided. Some go further, where refusing to publish unless the data sets are deposited into a trusted repository. And Canada's tri-agency open access policy reinforces this idea. It requires CIHR-funded researchers to make their data publicly available when they publish. So together, this funder and journal mandates are changing expectations. Open data is becoming the default, not the exception. Beyond compliance, there's scientific reasons, obviously, to share data. Data sharing enhances reproducibility and builds trust. So this is a quote from the journal Nature. It emphasizes that an inherent principle of publication is that others should be able to replicate and build upon the author's published claims. Data sharing also promotes collaboration and reuse, and is championed by Canada's Federated Research Data Repository. I'm trying to bring in as much Canada as I can. Data is also the opens doors to discoveries well beyond the original scope of the original study. So the past couple of decades have shown that the power of bringing data together across studies and across countries. So for example, the COVID-19 pandemic, international collaborations pooled data to understand how risk factors like age and comorbidities affected outcomes, and to evaluate vaccine effectiveness across populations, something no single country could do alone. That's what shared data really does. It multiplies knowledge and speeds up progress. So whenever we talk about sharing participant data, the first question that comes up is always about privacy. Could someone be re-identified? So in theory, that's possible, especially if data were combined with external information. But in reality, there are very few, and I'm not aware of any, documented cases of re-identification from a responsibly shared resources like a repository. Another concern is misuse of sensitive data. For example, reproductive health information such as abortions can be misapplied or even weaponized in jurisdictions with restrictive laws. And I'm sure your minds are turning already. I live in the United States right now. Our study has data on vaccines. It has data on maternal use of Tylenol, for example. So, so looking ahead, though, we're in a realm of AI. I saw several posters out there that were about AI. I do have a little bit of a concern that with AI and machine learning, it could amplify the privacy risks. So models that are trained on large linked data could uncover patterns that a human might miss, potentially lowering the barriers to re-identification. So privacy concerns are real. While the likelihood of re-identification is low, the consequences can be significant. That's why data sharing must always be accompanied by safeguards, data use agreements, controlled access systems, and technical protections to maintain the trust of our participants. Data can also be taken out of context or misused. That's part of the reality of open science. But the benefits of broader access, in my opinion, far outweigh those risks. We have some systems in place, peer review, replication, open debate to correct the record when needed. I think, Herzl, you might have some comments on that. So shared data sets can sometimes reinforce stigma if used without care. So you have studies already that I know have participants from the First Nations. We also have participants from Native American communities. So for example, imagine a data set that includes health data from Native American participants. If secondary researchers publish findings showing higher rates of substance use or chronic disease without context, without acknowledging systemic inequities, historical trauma, or barriers to care, those results can reinforce harmful stereotypes rather than inform solutions. So this kind of misuse can erode trust and discourage entire communities from participating in future research. Data can also be used in ways participants or even us as researchers never intended. For example, environmental health data could be cherry-picked or misinterpreted by industries that have a vested interest to minimize the risk. So these are real concerns. They demand safeguards, but they are not reasons to stop sharing altogether. Why not share data? I will be one of the first to acknowledge there are reasons. So for one, not all data look the same. The life sciences actually have data that are well-structured, machine readable, like genomic sequences. But then social sciences might produce interviews or surveys that are harder to standardize and harder to anonymize. Some fields like genomics have well-established repositories and standards. Others may lack the resources or institutional support to curate and store those data properly. Disciplines also vary in their attitudes. In some fields, it's the norm to collaborate, and replication is expected and hoped for in a lot of cases. In others, the traditions of individual scholarship or fear of being scooped discourage sharing. We're in an academic environment. Academic reward systems still value high-profile publication far more than they value data sharing. And until we have a robust system for citations that recognize shared data sets, the incentives remain misaligned. How do we share data? So in practice, data sharing is typically accomplished through controlled access repositories, and those who use them must apply for access. When preparing data for a repository, the first priority is protecting your participants. That means de-identifying the data by removing the names, dates, or anything that could be linked back to an individual. Sometimes it also means withholding sensitive data. I had mentioned abortions, for example. If you know that it could be misused or a high probability of misuse, then you just may not provide it. And that's a decision that's made typically by your steering committee. You might also withhold data on small or vulnerable populations. For example, we don't make our data shareable on Native American populations. Also, anyone who uses the data must sign data use agreements that make it clear that re-identifying participants is strictly prohibited. So this statement from Canada's Open Government Action Plan captures the problem we face. It says that the value of government-funded research is enormous, but without making it open, findable, or clearly communicated, much of that value is lost. So in the rest of my talk, I'll focus on how to enrich the research infrastructure in data science so that the data are not only accessible, but truly usable. And a key framework for making that possible are the FAIR principles, if people are aware of FAIR principles. I'll go ahead and give a brief summary of that. So when we talk about making data fair, we mean making it findable, accessible, interoperable, and reusable. So data should be findable, meaning that it should be easy to discover through rich metadata and well-designed search tools. Should be accessible with clear and transparent conditions for retrieval, and that often means you've got a tiered access system. It needs to be interoperable, meaning it can integrate smoothly with other data sets and platforms through shared standards and open licenses that make and open formats like CSV or JSON. It must also be reusable, supported by good documentation and licenses that make reuse possible and responsible. So supporting FAIR isn't just about storing data, it's about making it usable. So that means creating environments where public use data connect with tools for semantic search, and we'll talk about semantic search and AI-driven exploration. So the FAIR principles give us the foundation, but the real impact comes when we build on that foundation with tools that allow research to actually discover and analyze. So that's the direction we'll turn to next. So this schematic shows how the FAIR principles translate into practice. So this is just giving you a template for the workflow. So researchers begin by searching the metadata, either through keywords or specific aims, and then they can select data sets and variables that match their needs. And then the system supports an initial view of the descriptive statistics, giving insight into the data before requesting full access to do more complex analyses. So let's dive into that. So to show how this looks in practice, let me introduce ECHO. And Kant, thank you for giving an initial introduction. So this is a nationwide study that exemplifies both the promise and the complexity of data sharing. ECHO or the environmental influences on child health outcomes. And I supported an initiative that unites dozens of existing child and pregnancy cohorts across the US to create one of the richest child health data sets in existence. These cohorts now operate as one large ECHO cohort, following enrolled children and new pregnancies under a common protocol. The central question is simple but powerful. How do early environmental exposures shape child health and development? It's a question of profound scientific and public health importance with direct implications for the well-being of children and families everywhere. The breadth of the ECHO dataset is extraordinary, with 20 domains covering everything from demographics to clinical measures, environmental exposures, and child developmental outcomes. We have more than 1,200 data collection forms, some that have been newly identified for the common protocol, and some that existed before. These cohorts had been in existence prior to coming together. So 1,200 data collection forms, and all that effort to put that together, we have more than 40,000 variables in the data set. So it starts to, and 6 million records, so there's a lot of potential there. So this highlights both the challenge or the sheer complexity and the opportunity for scientific discovery. So with so many variables in ECHO, finding the right data can be a challenge. So that speaks to the incredible depth, but the richness of the resource. In the 3 years since we've made these data publicly available, there have been 97 data requests. And initially I had this as a half empty statement, but I'll make it a half full statement, reflecting strong early engagement with researchers as they're starting to explore what's possible with these data. But still, 97 requests in 3 years is maybe underwhelming. So that's exciting. This is just the beginning. As we improve tools for discovery and usability, we can expect interest and impact to grow exponentially. That's really the opportunity here, to move from simply having shared data to having fair data. So the full potential of ECHO can be realized. So let's begin with the first step of searching metadata through keywords. So in the figure on the bottom, you see the current keyword search tool that we have for ECHO. And it just says data dictionary. We've got quite a few tools for doing queries and stuff, but let's focus on this for the moment. So let's say we search for a word like seizure. This returns, of the 40,000 variables in our data set, it returns 3 variables: history of seizures, age at seizure diagnosis, and source form from which the seizure information was drawn. You can also notice here we get a little bit of descriptive statistics here. We get the number of participants that have that variable, but it doesn't tell us exactly how many participants have seizures. It just tells us this is the number of participants that have non-missing data for seizures. But let's say I'm a naive user. I come in here and I said, instead of saying seizures, I say epilepsy. In this case, epilepsy retrieves nothing, even though it's the same concept. So this illustrates the problem with using an exact search, or a lexical, referred to as a lexical search tool, where valuable data can be hidden simply because of the choice of words. So lexical search matches exact words. That means if you don't use the right word, you might miss relevant results. So for example, searching for asthma won't find wheeze. It also can't capture context. If I search for executive function, it won't return variables like motor planning or emotional regulation. So while data are technically findable, only users who already know the right vocabulary can access them. This can exclude experts and non-experts alike. Semantic models understand the meaning and synonyms. For example, a search for epilepsy would also return seizure. So this reduces the burden on users to know the exact vocabulary, spelling, or even the field-specific jargon. As a result, discovery becomes broader, deeper, and more inclusive, making data more findable for everyone, not just domain experts. So what's important to emphasize is that we can achieve this value without the heavy lift of mapping every variable to a detailed ontology. And I know there's been a lot of work that's been put into ontologies, and there would be a lot of work to put our 40,000 variables into an ontology, but this sort of bypasses that. That makes semantic search a very practical step forward compared to purely lexical approaches. So let me show you what this looks like in practice. So here's the landing page for our new semantic search tool. Searching for BMI retrieves not just exact matches, but synonyms and related terms, a process that we call keyword expansion. So that brings in variables like body mass index or BMI z-score, and it results in 156 matches instead of just the handful that would have matched for BMI. So users can then click on the graph icon to view the distribution. So this is already a step forward. I can take a look at this and see exactly the distribution for child BMI. So this makes the metadata actually come alive. Users don't just see the label, they see what the data actually look like. So if you want to retain this variable for future analyses or we're going to do a little more complex analyses, you can click on the add icon and place it in the cart for later use. So when you think go shopping on Amazon, you put something in the cart, same idea. It stays there until you remove it. Finally, results are ranked by relevance, with child BMI at the top and less direct measures like diet and physical activity further down. So here, even though you can look at this, the relevance column is shown there. Initially, I wondered why these variables were even identified, but then I realized that diet and physical activity are factors that play into body composition. But the good news here is the most relevant was at the top, and you see the real significant drop in relevance there for these. But it's all there for you to view and decide which ones you want to pursue. So far, I've shown how improved search from lexical to semantic can make metadata more findable. But what if researchers don't want to search one keyword at a time? What if they want to start with their entire research question? That's where AI comes in, helping us to move from keywords to aims. So building on that idea, we tested whether AI could take a full research aim and automatically surface the most relevant variables. So here's an example of a specific aim that seeks to assess outcomes in children with autism, measured across well-being, emotional health, and physical health. So the AI breaks the text down into parts. And in working with somebody, we work together to break it down into exposures like autism and social responsiveness scale, or SRS. I'll refer to this as SRS in the future, and outcomes like child well-being, emotional health, or BMI, and then other relevant terms. You might want to do things like the population or a moderator that you want to put in those other terms. So it'll do that. So from this, I put the search term, I click search, and that it retrieved 197 variables, with the most relevant autism clinical scale, SRS summary score, and emotional reactivity score at the top. Users can then add these to the cart and run some crosstabs. So you see that link there for crosstab. So this table at the top shows, top of the screen, just compares autism classification with emotional reactivity score. Below is the scatter plot and best fit line that describes the relationship between SRS scores and emotional regulation. So the ability to run even these simple analyses can help the researcher identify the best variables to test their ideas and assess the feasibility of addressing their research questions with the available data. No sense in pursuing it if the sample size is too small. In a second example, this time looking at occupational chemical exposures and autism, the AI again partitions the text into exposures, such as solvents and paints, and outcomes, including autism and SRS scores. When we ran that search, and I should show you here the outcomes, it says prenatal and postnatal, I think. When we ran that, it returned a lot of variables, but some that were really irrelevant. And I realized they were irrelevant because of what was in that other category. So I said, we took another spin at this, and I said, well, could you let me evaluate whether I think this is a relevant term that AI chose? So could we introduce a human in the loop? So to fix that, we added this human in the loop step so a researcher can quickly review and adjust what the AI extracts. So I was able to remove the other category and rerun the search. So with this adjustment, the results narrowed to 81. Remember, we had something like 190, narrowed to 81 more targeted variables, though still not perfect. For example, one of the top hits matched the word paint, but represented paint in the participant's home, and it was not an occupational exposure. So, it's not perfect, but you could easily review that and say it's not of interest. Sometimes expected variables ranked low in terms of relevance, and unrelated variables, unrelated variables I refer to as hallucinations, you've heard that term, ranked higher. So while autism clinical scale ranked high, the SRS scales were near the bottom of the list that was retrieved. So the AI tool returned spurious variables, such as an indicator for small for gestational age. How it got that, I don't know, or a preeclampsia diagnosis during pregnancy. So even with these limitations, this structured approach shows a potential of AI to make metadata more findable and interoperable. So let's return to this schematic for a minute. I've walked through the first 3 steps along the path to data discovery, beginning with searching the metadata, whether by keywords or specific aim, and then by selecting relevant variables, and finally exploring some descriptive statistics. Once those variables of interest have been identified by putting them in the cart, the natural next step is to request full access to the data in a controlled environment where deeper analyses can be conducted securely. So far, I've shown that how AI can help interrogate metadata and uncover relevant variables. But the potential doesn't stop there. When researchers enter a specific aim, AI could not only parse the study codebook or identify variables in the study codebook for relevant variables, but can also scan the published manuscripts and ancillary studies for related aims. So isn't this great? This would allow a researcher to see if their proposed research question overlaps with existing work, either already published or underway. So by doing this, we make sure that the new research questions build on rather than duplicate existing science. Right now, the search framework is built on a standardized metadata template. It includes data set names, speaking to the choir here, variable names, labels, and response categories. So the accuracy of the variable matches and it depends entirely on this quality of the descriptors. We've got some scores that are done for the promised health measures, and we realized in working with this that all of them had scored T-score or standard error. It didn't say what a T-score what, so it wouldn't retrieve those. So there's some work to do on the metadata to make this, and there's no way even the best AI could determine that it was relevant. So by improving the labels and contextual tags, we can boost both recall and precision, helping researchers find the right data more efficiently. So here's the foundation of how our search tool works. It's a templated codebook that defines all 40,000 variables in the ECHO data set. For each variable, we include key descriptors such as the source data set, the variable name, label, and data type. And together, these fields form the metadata that drive our search tools. So it's just an Excel file. But with this, it tells me where exactly in the database to find the data. Once you put it in your descriptive statistics or in your cart, I can easily look. It gives me a mapping of where to go find those data. So it's kind of beautiful. So the more complete and consistent the descriptors are, oh, hang on. Yeah. The more complete and consistent the descriptors are, the better the search performance. So currently, the AI tool works mainly from the structured metadata I just described, but rich contextual information often lives in protocols and study manuals and other documentation. So if we could start incorporating these sources, that would give AI much more context. And this could cut down on the hallucinations I mentioned, spurious matches, or misclassification by grounding the variables searches in the context of how those data were collected and defined. So I've shown how AI can parse specific aims into exposures, outcomes, and other terms, but parsing alone isn't enough. We also need to enforce the rules for valid causal inference. So for example, in the aim that seeks to assess outcomes in children with autism, we would really want the diagnosis of autism to precede the outcomes of well-being, emotional health, and physical health outcomes, right? So without that temporal ordering, it would lead to misleading conclusions if we just looked at those crosstabs. So incorporating that kind of analytical logic into the AI framework would make the tool not only powerful, but a lot more scientifically rigorous. Finally, that same templated metadata structure that powers ECHO can be extended to other studies. If additional studies use the same metadata format, the AI tool could integrate them seamlessly. So this would allow discovery across studies, enabling comparative analyses, replication, and large pooled data sets. So in other words, once the foundation is set, scaling becomes straightforward, turning ECHO into part of a larger ecosystem of shared science. So these semantic search and AI tools were not built in isolation. They came out of RTI, was the company I work for. They have a new program called the Alpha Labs Accelerator Program, which supports rapid AI innovation. The model is a 2-week sprint where the subject matter expert, in this case it was me, is paired with a developer. Every day we met to review the progress and make course corrections. And so this high frequency feedback loop accelerated development, allowing us to go from a concept to a working AI prototype in just 2 weeks. The midpoint demo, like the one you just heard described, gives us a chance to test ideas, get feedback, and pivot if needed before the final showcase. It's this combination of both structured support and rapid iteration that has made it possible to build tools like the semantic search and AI AIM parser. So earlier, I spoke about visionaries like Dr. Montague and Dr. Teo, who laid the foundation for world-class clinical research. Teo first at the University of Alberta, and then here at McMaster. So a key figure in shaping PHRI's vision and growth has been Salim Yusuf, whose leadership propelled PHRI for more than 3 decades. So under Salim's leadership, PHRI expanded dramatically in scope and global impact, becoming one of the world's leading research institutions. That strong foundation continues today under the leadership of Dr. Herzl Gerstein. Dr. Gerstein has built on this legacy, ensuring that PHRI remains at the forefront of population health research. This legacy of excellence shows what's possible when vision, infrastructure, and talent come together. And it sets the stage for the next chapter of innovation and data and AI. What I want to emphasize is that building these tools is not an abstract idea. In just 2 weeks, we had a working AI prototype, proof that meaningful progress can happen quickly with the right focus and collaboration. My hope is that some of the ideas I've shared today might spark some thinking about how some of the same concepts could be applied here at PHRI. PHRI's extraordinary track record with hundreds of studies and trials, supported by a deep pool of talented research staff, makes it an ideal place to extend these ideas. Efforts here to make your data more fair could even have a greater impact than what I've showed you today with a single study. The opportunity is to channel that capacity into developing the tools tailored for PHRI's own needs and priorities. This isn't an insurmountable challenge. It's a very realistic next step, one that could be possible, position PHRI at the forefront of data sharing and AI-enabled research. I don't know why the slide is there. This was supposed to be my thank you slide. I'd really like to extend, this is the end of the presentations. I'd really like to thank the Janice Pogue Lectureship Committee for having invited me to speak here today, and to Kant in particular for arranging for such a warm visit. It's been wonderful reconnecting with old friends and meeting the talented statisticians here at PHRI. So thank you, Kant.